All right, everybody, welcome to our monthly webinar series for Building Strong Brains. I'm going to go ahead and introduce our speaker. I'm really excited to have her today. Her name is Amy Jones, and she is actually a commission member of ours, and we are just so excited to have her. So Amy Jones is the Director of Juvenile Court Services for Madison County, Tennessee. In her department, she is responsible for the operations of an 8-bed juvenile detention center, juvenile probation, victim services, an evening reporting center, an intake and assessment unit, and various community programs such as youth court and summer work programs for at-risk youth. Prior to this, she spent 5 years as the Executive Director of the Madison County CASA program and 7 years with West Tennessee Healthcare, working in human resources and rural health research. Amy holds an undergraduate degree in psychology from Union University and has 2 master's degrees, one in education from the University of Tennessee and one in conflict resolution from Lipscomb University. In September of 2018, she became one of 4 certified Think Trauma trainers in the state of Tennessee. She also serves on the Tennessee Commission on Children and Youth and various community boards and advisory groups. So with that, I'm going to hand it over to Amy and pull up our presentation. So Amy, you can just take it away.
All right, thank you very much. So as Jen is getting that up on the screen there for us, just give you all a little bit of background about Think Trauma and how Tennessee got involved in this project. So we are, Tennessee, as I'm sure all of y'all already know, Tennessee's been doing a lot of work in the juvenile courts as far as the implementation of mental health screeners and assessments and into service planning for kids involved in the juvenile court. And Madison County, back in 2011, became the 11th county in a 10-county pilot to kind of get on board with that. And through that process, we met Kathy Gracie with the Vanderbilt Center of Excellence, and so we've worked together for several years on that project. Last year, Northwestern University contacted the Vanderbilt Center of Excellence with an opportunity to become, to send a contingent to become Think Trauma trainers. And I'll talk a little bit more about the origins of the curriculum shortly. But so the 4 people in Tennessee who are trained are Kathy Gracie, and I'm embarrassed to say that I'm drawing a blank on her 2 counterparts' names, but there's Kathy is ours in the western part, and then she has a counterpart for Middle and East Tennessee, I believe. And so there were the 3 of them, but they had 4 seats in the certification training, so they invited me to come along as the 4th, and I was honored to be selected to do that. So what we did last year, we went up to Indianapolis for a few days, and then a few months later we went to Milwaukee for a few days, and we went through this curriculum, first of all, as students. The first time we went through as students who were just learning it. The second time we went through as trainers. And the thing that appeals to me about this curriculum is that it is I think it's a nice complement to the Building Strong Brains work and the implementation of all of the ACEs study and all of the other trauma-related things that we're talking about in Tennessee. And those conversations are happening all over the place in all sorts of fields, not just juvenile justice certainly, but in all of the fields that touch children in Tennessee. So I think this is a nice complement. It's a sort of a practical type of training. It kind of helps people make the leap from the science and the theory into how do I implement this into my day-to-day practice. So I'm not terribly familiar with this WebEx software, but I believe that if you have a question, you can submit it down there in the chat box. And Jen, you tell me if I'm wrong about that. And if you all would,
right.
If we can hold those till the end, then I'll just do all those at once. I think that'll be the most efficient way to proceed. And at the end, I'll send out my contact information through that link too. So starting then through the slides, as I said, the Think Trauma curriculum came to us by way of Northwestern University. They had an agreement with the National Center to bring this to 4 states, and so Tennessee was one of them. Now, as I go through, what I'm going to do is just kind of walk you guys through the first unit of the curriculum. And one of the first things that I want to point out, though, is that these slides reference juvenile justice settings, but as a group for Tennessee, we made a determination that we were going to open this training up to any child-serving organization because we believe that the information is relevant and you can use it in any setting where you're working with traumatized children. So we didn't want to restrict it just to juvenile justice. So kind of anywhere you see those words, juvenile justice or juvenile justice residential, just kind of throw those out of your mind because for Tennessee, we've made a determination this is really appropriate for anybody. Okay, Jen, I'm having trouble getting the slides to click now. It worked just fine before. Okay. There we go. All right, I'm not sure why that wasn't cooperating before. So the first thing we would do in the training is we would obviously welcome the participants. We use this opportunity to kind of take the temperature of the room and see who we have, from what backgrounds. Okay, I've lost. Sorry, technology's beautiful. Okay, there we go. Jen, I think you may just have to click for me because I'm still not having any luck.
Absolutely.
So gotcha. All right. So the modules in the Think Trauma training, there are 4 of them. This training takes, in my mind, to do it really, really well, you would have 2 full days. To do it well and completely, you would need a day and a half. Our first training that we did here in Jackson, we could only get a day as far as the facility and getting people here and all that. So what we did, we went through the first 3 modules, and then we're doing webinars to take us through the last 4. I do not think that's going to be the ideal way to do it, but if you had a situation where you just absolutely could not get a day and a half or 2 days, then we could theoretically do it in a shorter time frame. So again, the module number 1, you'll see trauma and delinquency, but it's more for Tennessee. We feel like it's more just it's appropriate for everybody, so we're not going to focus on just the delinquency part of it. In Unit 2, we would move on to trauma's impact on development. Unit 3 is coping strategies, not just for the young people, but for their family and also for the people who are working with those children and families. And Unit 4 is vicarious trauma, organizational stress, and self-care. There is a temptation to minimize that Unit 4, but I think that would be a mistake. Unit 4 is some of the most important work that we do because I think it gets overlooked a lot, that we don't give as much attention to vicarious trauma and that as it's experienced by the people who are working with the traumatized children and families. So I really appreciate that this curriculum has a separate unit for that. All right, next. All right, so Module 1 is trauma and delinquency, and the objectives are for participants to be able to define trauma and describe how it differs from everyday stress. There's a lot of good discussion when you hit that part of the curriculum because it's the first time that some of your participants will have been asked to think about the differences between the two, and there's a really good point to be made that lots of good positive things can be stressful. For example, you might have a new baby in your house. That's a joyful, happy event, but it is also certainly very stressful. So we talk a lot about the differences between day-to-day stressors and what actually defines trauma. Participants will learn about traumatic stress symptoms and what they look like and how they are very different. The big gist of that unit is that they are very different person to person. Participants will better understand the role of trauma reminders and how they can impact youth responses. There's a lot of good discussion that comes from that one too, because a lot of people have not really thought through how in their workplace they may inadvertently have things that are trauma reminders for some of the young people in the families that have come through their workplace. Okay, next. I think one of the big positives about this curriculum is that in every unit, and sometimes multiple times within a unit, depending on the material, participants are reminded that self-care is very important. Some of the material in this curriculum is very powerful. There are a couple of pieces, as many times as I've gone through it, which is probably 100 now, there are still pieces of this curriculum that make me catch my breath, and they're very emotional. And especially if you have folks in your audience who have experienced some of these things themselves, or just the vicarious stress of working with families and children who are in those situations every day, you very well may hit something that's very close to home. And so you want to make sure that all of your participants are comfortable stepping out and taking a break if they need to. If they're reacting very strongly to it, you want to have somebody available to step out with them and talk to them. You need to let everybody know that it's okay if they need to get up and move around, or if they need to play with the little stress balls that are on the table or whatever. If they need to do something to ground themselves and kind of take themselves out of the stressful part of the curriculum for just a minute. And that's why it's really important to have more than one person training on this curriculum, because you need one person watching faces and body language and watching for anybody who may be reacting strongly. All right, next. All right, when we get to the how do we define trauma piece, we spend a lot of time talking about the definition again, but what we usually do is we put up two boards. We put up two flip charts or two whiteboards. And on one side, we have people tell us what comes to mind when they think of trauma. And then on the other, we have what comes to mind when they think of stress. And then we talk about the things that the two lists have in common, the places that they differ. And there's always some good discussion on that, especially if you have a cross-section of people in the room from different departments and different backgrounds, different fields. All right, next. So I don't know how many of you have, if you have seen the movie Freedom Riders, you probably know what happens. In the interest of time, I'm not going to try to play that video, but basically you've got a new teacher. She's in a high school classroom in an at-risk area of town. She's not quite sure yet of herself, so she's a little bit lacking in confidence. But you meet some of the students in her class, and you learn through their writing that they are living with some very stressful, traumatic situations at home. There's domestic violence, there's homelessness, there's poverty, there's a whole litany of things that are happening just in this classroom. Then it cuts to a scene from the teacher's break room, and the teachers there are talking about the kids and how none of them are really going to ever amount to anything, and that they're just putting in their time till retirement, and they're telling the new teacher, these kids aren't really worth you putting a bunch of stress into. So next slide. And so then we talk about how the behavior in that classroom and in the teacher's break room looks like things that your participants are experiencing in their workplace. If you would click that one more time, that will bring up the next. Yeah, so we talk about what do they see that's familiar, what do they see in the staff that's familiar, what are the things both externally and internally that are contributing to the way the kids behave. We talk about how the attitudes of those teachers is feeding into some of this. So again, a lot of good discussion around that. Okay, next slide. So it goes back into the classroom, and these are the manuals that she's reading where she's learning about some of their stories. So we can go ahead to the next one. So after we watch that, then we talk about some of the reactions. What are the events that we saw that would be considered traumatic, And we go back to the lists that we made in that first exercise, our list of trauma and stress characteristics, and we talk about how what we saw in the video matches up to those lists. And then we talk about what kind of traumatic events your participants' clients have worked with or experienced. So next slide. And so we revisit that discussion. Let's try again. How would you define trauma? And some groups you get, quite a bit of change, and some you don't. Kind of depends on what their level of familiarity already was with trauma. Okay, next slide. All right, so then we start to get into some definitions, and this first one is what is a potentially traumatic event? And the big strong point here, the big thing we want to focus on is to understand that trauma happens with the experience of exposure to actual or threatened death, serious injury, or sexual violation, and the individual. So whereas one event might not on the surface appear to be traumatic to me or to you, it may be very traumatic to the person who experienced it, and that is the part that matters, is how the individual is experiencing and processing that real or perceived threat to their person. Next slide. All right, so whether a situation is traumatic or not, this moves into the Mental Health and Substance Abuse Administration's definition. They use the 3 E's. So it's the event, the type of event or series of events or circumstances that happen, then how it is experienced by the individual, and the long and short lasting effects on the child's functioning. So it's a little bit of a different definition, a little more clinical, I think. So next slide. And this is just a list. We kind of brainstorm some traumatic events that happen with kids in the juvenile justice system, but these are applicable in most any situation. So next slide. Then we talk about some of the potentially traumatic events, and this says inpatient and residential settings, but you can also talk about this in terms of children who are removed and placed into foster care, children who have to be hospitalized for mental health issues. And one of the big takeaways you want your group to understand, is to internalize, is that a lot of times, we're doing these things because we say these are in the best interest of the child or the best interest of the community. But even if that's true, and even if it is the mechanism by which we get the child help for whatever is happening in their lives, it's still traumatic for most of them, because you are still taking them out of the environment that they've always known and into a very different environment. These are some of the things that children may experience if they go into residential settings, but you can have a whole different discussion, a whole different list for children who are in a new environment because of other circumstances. All right, next slide. All right, so this is one of my favorite exercises that we do during the training. We learn by experience, and this example that we're going to walk through is it's one of those. So at this point, I have everybody stand up, and I tell them we're going to pretend that we are a hiking club, and we've gotten together and we're going to go for a hike through a field or an area, maybe some hills or something, a place that we've walked before, a place that we have been to, but this time our trip's going to go a little different. So we are walking along, and we see, next slide, this. And I don't know if you guys are getting the audio or not, but there's the whole rattling of the snake's tail, and there's hissing and all of that goes along with there. And you can imagine the audience reaction you get when you bring that one up. Next slide. So we talk about some of the things that happen in your body when you saw that snake. Certainly, even just up on the screen, much less if you saw it in person. The way your brain reacts, the way your body reacts, the way your organs react to protect you from the threat. And we just go through and we talk about the different systems and how they react. And I think my clicker may be working now. I don't know why. So then we go back to the group and we say, okay, if I convinced you to go on another hike with me, and we were out hiking, and you saw this laying in the grass, what would be your first reaction? And is it different because you've already had the reaction to the snake? If you had walked up on this hose and you had never had the interaction with the snake, would it still make you jump? And so we use that as a way to segue into how something that might routinely be harmless can become a triggering point for a traumatized child. And we talk about then some of the stress reactions that you would see in a child who has been through something traumatic. And I'm not going to spend a whole lot of time on these two because these are things you would get more in depth in the actual training. Intrusion, avoidance, hyperarousal and reactivity, negative alterations in mood or cognition. And it gives an example of each one of these. There's an audio clip that goes along with each one of those examples. So we go on into dissociation. And then we move on into types of traumatic stress. Acute, complex, and chronic. We talk about that. For each one, we'll go through the exposure and the domains of impact, the developmental deficits that you would see with each one. The invisible suitcase. This is another very visual activity that we can do. We actually have either a suitcase or a backpack or something like that up at the front, and we get a volunteer to come up and stand there and hold the suitcase or the backpack. The point here being how trauma shapes a child's beliefs and expectations about the world, the people around them, who they can trust and who they can't. So what we do is we take either a brick or a rock or a weight of some kind, and we stick labels on them. It's all my fault, grown-ups lie, you're going to hurt me, I'm bad, I'm stupid, all of that. And then we start to pile those into the suitcase or the backpack that our volunteer is holding. It gets heavier and heavier, obviously. So it becomes a very visual metaphor for what these children are walking around carrying with them all the time. That always gets a good reaction from the group. So then we talk about trauma reminders. These are the things that you consciously or unconsciously connect with a traumatic event and how that makes it very easy to inadvertently trigger a child who's coming from a traumatic background. We talk about loss reminders, empty situations, shared activities, rituals, those things that remind you that somebody is or something is missing. We continue into the factors which determine the impact of trauma or loss, like the age, whether it was a caregiver who inflicted the traumatic event, their history, all those things. Lisa's 911 phone call, you guys have probably seen that in other trainings, but it is a real-life phone call of a little girl. I think she was 5 when she believed that she was witnessing domestic violence between her stepfather and her mother. At the end, you find out that there wasn't actually any physical violence going on, but it was her perception that there was. The point being that it is the perception that causes trauma. Regardless of, it didn't matter to this child whether anything had really happened between them or not. How she processed it was that there was danger, and so it became a traumatic event for her. This is a powerful clip. It's one of those places where you have to watch your participants closely because people do react very strongly to it if they've never seen it before, and even if they have, actually. So you want to watch. You want to watch for the reactions and then thoroughly process it afterwards. So this is the slide that tells you that nobody was actually physically injured, but it was still traumatic for her. We talk about some special populations, such as homeless youth, LGBTQ. And then we do an activity together. This actually, the faces that you see here, this activity, it has them printed out like jigsaw puzzles, and there's a bit of information about the child on the back of each puzzle piece, and so you put your participants in groups, and they work together to put the puzzle together, literally, but to also put the puzzle together of that child and the history and what led them to be where they are. It brings home the power of working together. So I'm sure that all of you have people who are working across section. You may be, maybe if you're a juvenile court, you might be working with people from DCS and mental health providers. Everybody has a piece of the puzzle to bring to the table, and we are most effective when we work together. All right, so that's the broad overview of Section 1 of the curriculum. I believe this is one of the better training programs that I've ever been involved in. My team has all been through it, and they found it very helpful, as I said, to bridge that gap between the science into the day-to-day practicalities. And so the reason that I wanted to get in front of this group today is we want to offer it to groups that would like to set up the full training. There is no cost involved. You don't pay us. You don't pay the trainers. You don't pay anybody. When we had the one here in Jackson, we got a sponsor who provided lunch. We used a free location at our Chamber of Commerce. The only expense that's involved is if you want to print a copy of the material. We can email it out ahead of time and ask people to print their own, but the Center of Excellence, when we had the one in Jackson, was kind enough to print copies of the manual for everybody. That's the only expense if you are interested in hosting one of these sessions. The ones that we've done have all been cross sections. They've been different groups. They've been combinations of court staff, providers, DCS. So it doesn't have to be just your agency. It certainly could if you wanted to do that. But if you wanted to pick a location and invite people from multiple counties or multiple agencies, that's very helpful for the discussion to have the different backgrounds and different viewpoints. The cap, I would not want to try to teach this with more than 50 in a room. It just gets too difficult to try to keep an eye on everybody if you're trying to do more than that. So I will open it up then for questions that anybody might have. And if you are interested in setting up a training, I'm going to put my information here in this chat box and send that out to you. So if anybody has questions, I'll be glad to answer them.
All right, everybody. So feel free to go ahead and put any of your questions in the chat box. And for those of you who are on the phone, I will read the questions aloud. While we're receiving some of those questions, Amy, I really want to thank you for this. And I want to reflect that with our work with Building Strong Brains Tennessee, a lot of folks are often asking, what's next? How does this information apply to my specific sector or field? And so it was really exciting for me to be able to bring Amy so that anybody who's working with at-risk youth, that they could have that sort of part 2 or additional training on how to support trauma-informed systems with at-risk youth. So, Amy, I'm so grateful for you for becoming a trainer and then also making this widely available to folks throughout the state.
Well, thank you. I'm pleased to have been a part of it because, like I said, I do think this is one of the more useful, hands-on, powerful trainings on this topic that I've been to.
Okay. So we've got a question right here. It says, I'm very interested in offering this to our neglected dependent and JDC facilities across the state. Great. Vicki asks, how long is the session? I might want it to be done at each school after school. So, Amy, I think you said a day to 2 days, right?
Yeah, 2 days to me is the optimum. A day and a half is good. Anything less than that, I do think you start to lose a little something. So we had to do it in 1 day in Jackson, and I just did not feel like I didn't feel like Unit 4 got the emphasis that it did. So, but a day and a half would be good. 2 full days is best.
Awesome. Okay. In here.
Now we could break it down into smaller segments. If you I think you said doing a few hours after school each day, you could break it down into smaller segments. I just wouldn't want to do it in any less than that total number of hours.
Mm-hmm. That totally makes sense. So, yeah, she said thank you. If there's any other questions, I just think, particularly with folks who work with at-risk or vulnerable youth, a lot of times individuals who haven't been exposed to a lot of this trauma-informed lens or way of thinking, they often take behaviors really personally. They're often triggered themselves, and it escalates, into becoming a more traumatic situation for everybody involved. More triggering for the teen and vicarious trauma for the provider. Would you agree with that, Amy?
Oh, yeah, absolutely. One of the more interesting things that we had when we did the training in Jackson, we had several school teachers come, and the consensus from them was this was something that every classroom teacher needed to see, because classroom teachers often don't have all the information about what's going on with the child outside of school. And so very often they can inadvertently trigger something, and then the teacher just thinks, what is wrong with this kid, and what is going on here, and that the teachers commented that this should be part of regular training for every classroom teacher, because they need to understand all of the things that these children are carrying with them.
Absolutely. While we're waiting on maybe some more questions to trickle in, one of my questions is, can you talk to us a little bit about the content in Module 4? So, specifically, how are you all addressing vicarious trauma and self-care, and how are you kind of supporting people to put self-care into practice?
Yeah, powerful. Unit 4 is one of the more powerful ones in this training, I think. We talk, because we have people in there generally from a whole lot of different backgrounds, we ask them to do some thinking about their own workplace. And first of all, where are you right now as far as creating a culture, a physical layout that helps your folks who are in contact with traumatized populations, that helps them get through their work day. So do you have open door policies? Do you have do people feel comfortable going to a coworker and saying, look, this case really got to me, this one was really bad, can we talk about it for a minute? We asked them to evaluate what are their policies around, do you insist that your team take their vacation time? Do you let people work themselves to the point of burnout? Do you create an environment that's like that break room full of teachers from the video? So we asked them to talk about where they are first, and then from there we move into, okay, we don't, for obvious reasons, we don't ask them to put this up on the flip chart or anything, but just from their own notes, okay, which of these things would you like to try to work on? And then we talk about how they might do that. So if they say, oh, we don't really have a physical layout that's where anybody has any privacy, where anybody has a space that they can go to catch their breath, we talk about how you might establish that. We talk about peer relationships in the workplace, and how you can create partners or buddies or whatever you want to call it, so that everybody has somebody they can come to and just blow off steam and debrief with. And then we talk about if you're not an administrator, if you're not somebody who's in a position to put things like that in place, what do you do? How do you take care of yourself? And we talk about the fact that every individual is more than the detention staff member or the foster care worker or the counselor. Whatever you are at work is not all that you are. And we talk about the importance of keeping that in mind, and leaving work at work and not taking it home. It's a pretty in-depth chapter, but that's kind of how it starts, and we kind of tailor that unit a little bit to the people who are in the room because everybody's situation is a little different. So that's kind of where we start.
I love that. So I feel like I've heard from you that, basically anybody working with children and youth could benefit from this. But specifically when we're thinking about sectors that could benefit, I think I've heard school teachers and school administration. I've heard juvenile court staff. I've heard staff working in residential settings. What are some other sectors that you think this training would be really beneficial for?
Definitely any type of like DCS caseworkers or workers with private agencies that are going into homes. Not even necessarily just residential, but if they're out in the field working with children and families, really it's anybody who comes into contact with traumatized children and families. So social workers in a hospital setting or in a school or anywhere. Literally, I think this is applicable to anybody who's working with traumatized children in any setting.
That's awesome. So when a person walks away from these 2 days, you talked about this being a really applicable training. What do you think that they walk away with? What skills, tools in their toolbox, or policies do you think that they might be walking away with?
Well, I'll give you an example. We in one of the trainings, we had a group that was with us from one of the mental health providers here in town, and they were talking about their intake process, like what happens when they first get that referral, and how do they go about meeting that family for the first time, and if they have them coming to an office for that first meeting, what does that office look like? What is there in that office that might be difficult or problematic? Is there anything in the environment that could be made more comfortable? And then they talked about the questions that they ask in their intake process. Are they thorough enough? Do they get all of the information? Are those questions trauma-informed? Do they really get at what happened to you versus what's wrong with you? They were talking about children specifically who had delinquency issues, but I think you get what I'm saying. When they leave this training, I think you have a way of thinking, and you have some tools that allow you to go back and look at your process every step of the way, and say, how could we do this better? How can I look at this from a trauma-informed lens? How can I look at this particular process and see what it looks like and how it feels to the person who's participating in it, not just me as the provider?
That's fabulous. All right. We haven't had any additional questions trickle in. Still feel free, participants, to write a question if you have one. In the meantime, Amy, do you have any parting words for us?
No, just if you are interested in hosting, or even if you know of another group who might be interested in hearing what I've done here today, just get in touch with me. Obviously, Jen can put you in contact with me, and it's not just me solo. There are 3 other people, so between the 4 of us, we've been able to cover the requests that we've had so far. We do have a couple lined up for the summer already, so if you're in the western half of Tennessee, we may already have something in place that you might could attend. I know we're going to do one for the school system in Tipton County, and we're going to offer another one here in Madison County because we ran out of room. We had several on the waiting list, so that's a possibility. And I just appreciate you guys letting me take your time today.
That's wonderful. Hey, Amy, we have several people that have called in. So would you mind just taking a second to verbally give your contact information for those who might want to write it down? Sure.
It's Amy Jones, and the email is ajones@, MadisonCountyTN.gov, and my phone number is 731-423-6140, extension 7114. And I'll say the email address is ajones@MadisonCountyTN.gov.
Perfect. And I will also be sending that out via email. Vicki has another question. She says, I'd like to attend the one in Madison County. When is it?
We're waiting on confirmation back from the Chamber of Commerce that we can use the same room, but we're looking at probably the end of August, because that gives everybody time to get kids back in school and all that. So that's kind of our tentative goal.
And Amy, if you want to send me dates where there's open registration, I can post it on Basecamp for all of our folks.
Yeah, wonderful. Thank you.
Okay. Well, everybody, thank you so much for taking the time to be with us today, and a special thanks to Amy for sharing this with us and bringing this wonderful resource to our state. I'm just so excited to see all of the ways in which we can transform systems and strategies to benefit children and youth and improve health and wellness in our state. So with that, we'll go ahead and end, and I hope you all have a great rest of your day.
Thank you all again for letting me be on today.